We'll move into our 8:35 item, and it's our COVID-19 update. We have our Public Health Director, Kathy McKay, and we have our Nursing Director, Jamie Hinnon, and we have Becky here with us again this morning.
Good morning, Mr. Chair.
Good morning.
Commissioners.
Welcome back.
Good morning. I'll just pull up the slides. Okay, so we'll start with the case data. So as you can see, the active numbers are similar to last week, but they're slightly down in Clay County as of October 18th. We have 368, and last week we had 375. We're seeing a little bit of decrease, excuse me, in the Minnesota cases as well. So 24,587 was last week, and now it's 23,486. So there's a slight decrease. You're seeing the decrease in Cass County. We were watching that data as well, and they did have an increase, peak kind of in this fourth wave sooner than Clay County, but they've also been one of the highest, if not the highest state for the active cases. So they're at 599 this week, and then in North Dakota, they're seeing a decrease as well with 3,210. So the last decrease we had was in cases was a small amount in the week from September 20th through the 27th. We saw a little bit of a decrease in cases. We're looking at the active cases by age. So you can see about a third of the active cases are under 19 years old. We continue to see cases in the school-age children. So, and that has been kind of an ongoing trend. And looking at the total cases, we now are over 10,000 cases. And so this is the total cases throughout the pandemic across the age groups. And you can see again, it's similar to what we reported last week. And the Clay County cases per week from July to current, so we're seeing the upward trend. So the week of October 3rd through the 9th, there were 256 cases, which has been the highest number in the fourth wave that we're seeing. So we're still, the waves of the pandemic typically are 10 weeks or so, depending on, and we're probably in the middle or a little bit above that, about 4 to 5 weeks. So in that wave for Clay County. So we still are in the fourth wave. And these are the numbers of cases per week. So you can see, even with, a little bit of decline that we reported today of active cases, we still are not sure if that's going to trend downward. That's our hope, of course, but we'll see if that continues to be a trend downward. And then we'll go to Becky.
Good morning.
Morning, Becky.
So this first graph again shows Clay County deaths reported per week. And fortunately, we have not had any newly reported deaths since last week. So our death total remains at 98 for the county. And then this graph depicts the number of COVID hospital admissions for Clay County residents per week. So you can see that our numbers have actually dipped a little bit over the past few weeks, which is good news. And we hope that trend continues. So we had 4 admissions reported for last week so far. And then this slide breaks down recent hospitalizations of Clay County residents by age. And as you can see, the trend is not changing week to week. The pie chart on the left, we can see that the majority, 65% of those hospitalized since August 1st are under the age of 65. The bar graph on the right shows the breakdown of admissions in each age group. And so the 4 new admissions that we've had since last week have been in the 20 to 24 age group and the 60 to 69 age groups. And then this hospital capacity information that we have for our local hospital systems is something that had not been available up until last week. So we're thankful to have this information available to us now. So as you can see in the first column, this is staffed ICU beds available. So Essentia and Fargo currently, or as of yesterday, or as of the 17th, excuse me, had 0 available ICU beds. Sanford had 5, and the Fargo VA had 4. Pediatric ICU beds available for Essentia were at 3 available beds, and Sanford at 1, and those were statewide. So there was 4 available pediatric ICU beds available yesterday. And then this is statewide hospitalization data throughout the state of North Dakota as of yesterday. So there's currently 191 hospitalized due to COVID, with 21 in the ICU. Last week, the number hospitalized was at 211, and the number in the ICU was 24. So we have seen a decrease statewide in number of hospitalizations. The chart in the middle shows current hospitalizations broke down by age. So you can see there's currently 3 pediatric COVID admissions. And then the chart on the right shows the cumulative hospitalizations broken down by age group. And here's the updated graphic from the Sanford Health System. Again, we are continuing to see the same trends. The red people represent those that are not vaccinated, and the white represent those that are vaccinated. So the overwhelming majority of hospitalized cases continue to be among those that are not vaccinated. 29 of the 30 patients on ventilators are not vaccinated. And then the breakthrough data that's put out weekly by the Minnesota Department of Health is shown here. Again, we're seeing a little bit of an increase in the number of breakthrough infections that we're seeing in fully vaccinated individuals. So that number is at 1.441%, so still very low. Breakthrough hospitalizations remain low at 0.085%, and breakthrough deaths at 0.007%. So the main message with this graph is just that the vaccines are doing exactly what they are supposed to do. We do expect to see breakthrough infections in individuals, but they are doing their job and keeping people out of the hospital with severe symptoms and reducing deaths.
Jamie.
Jamie?
Excuse me. Good morning.
Morning.
First, we'll look at the statewide vaccine data as of October 14th, 2021 for ages 12 and over. So this week, the number of people with at least 1 dose of vaccine is at 73.1%. Last week, we were at 72.8%. And those who've completed the series this week, 69.6%. Last week was at 69.2%. So slow progress on there. But I want to draw your attention to the 12 to 15 and 16 to 17 population. Although we've been making some good progress, we're still sitting at 50% roughly for the 12 to 15 who've had that first dose, and not quite 50% for the completed of series, and then 60% for those 16 and 17, and then at 56% of those that have completed the series. And the reason I brought that up is that this week Governor Walz announced that they're doing a campaign called Kids Deserve a Shot Vaccine Incentive Program in Minnesota for those that are 12 to 17 years of age. So a $200 gift card is available, and also the program includes a drawing of 500,000 Minnesota college scholarship drawings. So the first dose needs to begin between October 18th and November 9th, and they need to receive their second dose by November 30th in order to qualify for that incentive. So that's what just started yesterday to try to boost those up. And then I'll just go to the data on the vaccines provided by Clay County Public Health. So our total for Clay County Public Health vaccine provided 15,697. This last week was our first week with the Pfizer doses, and we provided 66 Pfizer doses, and then just under 10 of the J&J, and then also just under 10 of the Pfizer first and second doses. We continue to try to get those to come in for the first and second doses. Also, just want to remind you that during the beginning of the vaccine, when they were provided in December and January, the Pfizer vaccine went to hospitals, and we don't have a hospital, so we didn't have the Pfizer vaccine available to us. So we are expecting a very large change once the Moderna booster is approved, because that's when we really started to provide big vaccine clinics, was with Moderna. So we're planning for that. Planning some community events, talking about a Saturday event once Moderna is approved as a booster as well. For this week, we're having at least 2 clinics. We're trying to do an off-site clinic and get that scheduled this week, but for sure, in the Family Service Center on Wednesday, we'll have a 10 to 2 clinic. We're offering Pfizer first, second, and booster doses, and Johnson & Johnson as well. And then on Thursday, again, a 1:30 to 5:30 clinic, and we're providing Pfizer first dose, second dose, and boosters, and J&J. With having that available last week, we really did work hard to try to get people to come in for those boosters, to get those boosters, or to get all the doses used up that we had. We had an expiration date that we were dealing with last week, so we're thankful to all those that quickly responded and took advantage of those vaccines that were available. And we're going to be in that same scenario this week. We've got Pfizer doses that are going to expire, so we really need to count on people coming out and getting those vaccines. Any questions about that?
Questions?
Should I talk about this? Yes. So we do have the data from the saliva testing site, and they did, as of the 17th, opened up on Sunday, so we're thankful for that. So we have an opportunity for people to come into the Vault saliva testing site in Moorhead. So we've got Monday through Thursday, and then again on Sunday. The week of October 3rd, we had the number of tests conducted during the week was 585 with a 10.02% positivity rate. So we had a higher positivity rate than what we've seen for a while. The data is not on here from the September 26th. I don't know why it's not on there, but it was not quite that high. And that, the other part of the saliva testing site is very soon. We will be offering, the Vault site will be offering rapid tests as well. So
Good.
we're excited about that.
That was going to be my next question. I did see some communication between Cass and Clay regarding being overwhelmed with the rapid test. Do you want to just talk a little bit about that, Kathy?
Sure. There was a real limit of getting the rapid tests. There's plenty of opportunity to receive the PCR test, which is the one that takes anywhere from 24 to 48 to sometimes longer to get the results back. And there's so many that are interested in getting a rapid test so they can either go back to school or work.
Travel.
Pardon me?
Or travel?
Or travel, correct. Yeah, we had some that requested that as well. And it was really hard to get the rapid tests. Some of the pharmacies required a 2-day notice to get in and get a rapid test. So it was challenging to find a rapid test immediately. And Fargo has a test site that they were offering rapid and PCR tests Monday through Friday, and accepting Minnesota residents as well as North Dakota. But as testing increased and more people wanted tests, and particularly rapid tests, they became overwhelmed. They just don't have enough staff. They had to work with their long-term care facilities and others. So they really had requested a couple of times about getting another rapid test site in Moorhead. And so I reached out to the state health department. Then the initial answer was no, that Vault testing would not do rapid tests. They're just doing the PCR. So, it was a little bit frustrating. I reached out again to the state health department when I heard that Vault is now considering rapid tests, and said we really have a high need in our area, particularly when we're overwhelming the North Dakota side, which is not what we want to be doing, and short of them refusing Minnesota residents. So we just heard yesterday that they're indeed going to offer rapid and Vault at the Vault testing site. We don't know time frames or dates yet. We should be hearing that soon, but that was good news that we can now offer rapid tests to eliminate the large number of people from Clay County and other counties in Minnesota that were overwhelming that Fargo site.
And that's going to be at the same location?
Correct. Yes.
Is there a difference in the rapid testing? Heard rapid test came back negative, but the state, they must send it into the state, and that came back positive. Are you hearing of that happening much, or?
You know, Becky, our epidemiology expert, can explain that a little bit.
Sure, we do every once in a while see some discrepancies where people will go in for a rapid test and that's initially negative and then the PCR comes back as positive. So it's not unheard of and it is usually a rare instance, but it does cause some confusion. And then we just have to look on a case-by-case basis, you know, is the person vaccinated? Are they having symptoms, to try to weigh into the equation of are they truly positive or not. The way the tests are developed, that a false negative rate is much higher than a false positive. So typically, if you do test positive, we go with that because the test is picking something up that's there. But you're correct, it has caused some confusion for some folks.
Commissioner Ebinger.
Is Vault going to continue to test people from other states with a rapid test? Will that be available, or is it going to
You
be
know,
limited?
my hope is that that will be the case. I haven't heard the official information yet from our state health department. So that will be my request, that we can also accommodate North Dakota. They've been accommodating us for such a long time. So my request will be that we accept both. I suspect that will be the case because they still are accepting both for the PCR tests. So I'm assuming that they would want to follow that same protocol. I'll ensure that we at least get that request in.
Just going back to Becky, is the rapid test not considered as accurate as the other test?
So the PCR is considered the gold standard for testing, but it does, like I said, to get a false positive is extremely rare. So there are some instances the other way around where people will test positive on the rapid test, but then negative on the PCR, and those are even more confusing to try to work through.
Okay.
I don't know if that answers your question, but for the test to turn positive, there has to be viral RNA circulating for it to turn positive, unless there's, you know, some contamination with the testing or some error in the lab side, but that's, you know, very, very rare.
And Kathy, again, in terms of when the rapid test will be available, you'll put out some announcements on that?
Yes, correct. We'll send that out. We'll put it on our website. We'll also post it on our Facebook page and then get it out to the other, officials in our county, the other cities, so they are aware of when that will be. We understand it'll be next week, but we'll get more information. That was new as of yesterday, so.
Commissioner Cayley.
So you've been sharing the data from Fargo hospitals. What are we seeing in hospitals and counties surrounding?
You know, we were just on Steve and I were on the hospital meeting for the Fargo hospitals last Thursday. And I was also on, and Jamie, maybe you were on that one, for hospitals in the Minnesota side. So they have meetings as well in regards to its hospitals, pharmacies, public health agencies are meeting weekly to talk about, mostly about the vaccine, testing sites, and their hospital capacity. And as far as I know, the hospital capacity is the same in Minnesota. They're still seeing a lot of, they're seeing COVID, but they're also seeing all the other things that they need to deal with as a hospital. So we aren't, nobody is like not being able to accept, but it's limited numbers of ICU beds and those taking up ventilators in the regular hospital bed. So even though maybe the COVID numbers that are hospitalized are much lower than the other things, it still puts the hospitals at a capacity that we are concerned about. So if we have less COVID, which is a low percentage, then they have more room for the emergencies that they're seeing. So they're in the same boat as Sanford and Essentia at this time. They didn't give us the exact figures at our call, but we meet weekly to discuss the hospitalizations in the Minnesota ones. Hopefully that answers.
All right. Any other questions? All right, thank you. We'll see you next week.
Yeah, thank you.
Thank you.